15 minutes time for the discussion. So if you have any questions, please focus on your question. Be focused on your question and direct. If you wish to direct the question to a particular speaker, please mention so. Right. Please raise your hands if you have any questions. So please pass the microphones.
This is regarding the final presentation. Actually, they said that the coverage is 20 to 30 nautical miles, and I would like to know whether have you developed any amplification and external coverage appliance which can attach to your smartphone to benefit for the people who do very distant fishing.
Thank you very much for the question. So yeah, the technology is there, but it's a bit costly, I would say, in terms of so there are signal amplifiers. As I said, to some level, if you know that the route that you are going into, they can know the extent of signal at different locations. But if it is not, there are signal amplifiers that they can take in. There are like various technologies. We have researched about this as well. But implementation and the sustainability of the product is a bit questionable at this point with the the current foreign forex the currency rates as well. So it is there, the technology is there, but yeah, working towards it is something that we are researching right now. We have to implement it to some level.
Have you? The other one is now you said that you have sent millions of SMSs over these different issues. Do you have a feedback corridor to analyze your service by the users? I mean, have you analyzed the feedback of your SMSs and how useful was it for the users?
Yeah, so I think as soon as we launched this product, the COVID hit, and then there were other issues. But we have done our research. We have conducted ground level research, saying that I think most effective method was the call, because we if the person so we try twice. We don't just when they hang up, we just if the signal is not there, we just don't stop there. We send another call within the next 5 minutes, right? So I think calls have been the most effective. Also messages, in terms of when they miss it, they have also looked up to it. I think simplicity of the message and the language has also helped them to understand. So we are doing yearly ground research to some level to get feedback. That's what we have seen so far, and that's how we have seen the people. So we have different requests saying, so when we did the app, when we developed the app, making the route, the marking the route part, and the emergency beacon. So those are things that the fishermen requested. Give us these services so that we can implement it. So that's how we have done it so far.
And one final question. And do you have in that app? Do you have a emergency platform for the user so that he can quickly access the shortest emergency support team? Do you have that access?
I think we are implemented with NARA. Yes. So that part is there. So basically, to the closest as well as we send the information to emergency contact as well as the authorities.
Who are the government stakeholders who are involved in emergency supply service in Sri Lanka at the moment with your application?
So application is mostly NARA is there, and then we have, as I said, the partners. MIPA is with us, Department of Fisheries. So those are the government organizations as well as the Navy.
Thank you very much.
Are there any more questions? Yes, yeah, right.
It's regarding this digital health and mobile health interventions. My question is then, as a private organization, or you are aiming at profit. So when we are applying this health application, how you make it profitable? Or at least say if you are running by a program, suppose it is health ministry program, at least there is some operational cost in this application. So for the servers or whatever things. So at least to cover the operational cost, how you can make these apps profitable while keeping the quality of that app. That is we are not aiming at the higher profit, violating all our ethics. Not like that. How you balance these things, keeping the quality of the app and make it profitable?
Yeah, I think to answer that question, I think the call services, the voice service is free, but the app is not, right? So it is we charge them an affordable amount, let's say rupee per day or 2 rupees per day. That is how we are planning to make it sustainable, right? We don't like to call ourselves CSR at this point because it's not like when, let's say, with the current situation of the country, we can't do that. It's not sustainable. And also what we have done is our plan is to not create an ROI, rather than our plan is to make it cost neutral for the company. Again, for the Sairu, the business case, I would say that we are planning to hit cost neutral within 2.5 to 3 years. So that until that the company will bear the cost, but we are planning to hit the cost neutral level. Again, charging the customer a right amount of time. Also, that gives us accountability to provide a quality service. That holds dialogue and the rest of the partners accountable to make sure that we provide a quality service. I think that's
Thank you.
I think we have few more time for a few more questions. If there's any, please raise your hand. Does anyone have a question? Yeah, Lakrutvalla.
Now in Health Ministry, Health Promotion Bureau, we have 661 digital signages connected throughout the country with the primary care institutions. So we run the same channel by Health Promotion Bureau, but we face, actually this goes to Tarusha, we face the connectivity problems all over the island. And also, end of this year, we are facing a lot of difficulties in the sponsorship on connectivity and other things. So, digital connectivity, we are running this through the internet facility, the same thing. And we need very small bytes or just to, throughout the whole day, we put only 2 times new programs, new channel, a new program. 2 times daily. So, but with that also our hospitals faces a lot of difficulties in connectivity. What are your solutions and whether we can collaboratively work for those solutions for this network to expand as well?
Definitely, yeah. Definitely working together is something that we want to do. As I said, we believe in partnerships. We never want to reinvent the wheel. So I'm happy to have a discussion in terms of how we can help. In terms of dialogue connectivity, we have coverage covering, I can say for sure that we have covered 95% of the population through voice, but not in terms of data. But yes, we are covered. We are constantly working on improving our coverage. I think I think we have the largest coverage, and so in terms of there are similar slots where some areas that is not covered. Yes, as the company is working to cover those as well. Definitely happy to work on implementing whatever collaborating with the project.
Okay, I have one question to Dr. Vinya Ariratna. Hope you are connected. Dr. Vinya, is there a way that we can get Dr. Vinya on screen? Yeah, Dr. Vinya, my question is about the multi-stakeholder partnership, the engagement. So in this, I know it is very important not only for injury prevention, for any public health issues. So have you or has anyone mapped the stakeholders and their connectedness? Because that is very important for us to understand their dynamics with respect to the technical flows and financial connectedness. For the injury prevention, was there any such effort, and what was the outcome of that, if there's any?
Thank you, Professor Senra. Very important question. I don't think, honestly, for injury prevention, that measurement has been done, or even a mapping for that matter, but that's a good suggestion, and we are at the moment in this particular program to prevent drowning deaths. I think, as I mentioned in my presentation, we will try to see whether there's a link that we can make between the reduction of any cases as a result of our program or not. I think that's very important and a very good recommendation, and I think the others can also follow. Now, the issue is that in the health sector, the partnerships are not very well coordinated and managed. So you have partnerships for NCDs, partnership for mental health, partnership for palliative care. So I think it's a good suggestion if we can also do a mapping and see how we can strengthen partnerships. I think if Health Promotion Bureau, IC, I mean, if they can take the leadership, we'll be very happy to support the mapping exercise and to measure the success of different interventions through these partnerships. Thank you.
Yeah, through this approach, I think we can share our resources as well, so without wasting, optimize the resources, because certain units or persons can be used for multiple tasks as well. So thank you very much for your response, Dr. Ariratna.
I think no more questions, and we want to thank all the presenters and of course the audience for creating very interesting concerns. Thank you.
Thank you, Madam and Sir. Following that very enlightening and admirable plenary on how community engagement, social marketing and public-private partnership can prevent injury, it's time to pay tribute to our renowned resource persons. I warmly welcome Dr. Lakshmi Somatunga to present the token of appreciation to Mr. Tharusha Vanikasekara. Also, Professor Pulsanala to present the token of appreciation to Dr. Sheila Gunaratna. I most cordially invite Professor Mark Stevenson to present the token of appreciation to Dr. Lakshmi Somatunga and Professor Upul Sanarat. I welcome the speakers and our chairpersons for a good group photograph.